Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes, and metabolism. Let's get started with question number 1. For the following case, which of the following is the most likely cause of this patient's condition? A. Botulism. B. Down syndrome. C. Galactosemia. D. Hirschsprung disease. E. Hypothyroidism. F. Phenylketonuria. The case scenario is: a 2-month-old boy is brought to the emergency department due to progressively worsening floppiness and poor feeding. The infant was born in Eastern Europe via an uncomplicated vaginal delivery to a 38-year-old woman and then immigrated to the United States with his family. The parents describe the infant as a good baby, who rarely cries and sleeps through the night but has lately been difficult to rouse for breastfeeding. Stools have also decreased to every other day and are small and pellet-like. Physical examination shows a hypotonic infant with a large anterior fontanelle, large tongue, and a reducible umbilical hernia. He has low tone and is unable to hold his head erect on his own. No other abnormalities are seen. The question is, which of the following is the most likely cause of this patient's condition? Your options are: A. Botulism. B. Down syndrome. C. Galactosemia. D. Hirschsprung disease. E. Hypothyroidism. F. Phenylketonuria. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is hypothyroidism. This question is designed with the focus to assess your ability to make a diagnosis. Congenital hypothyroidism is one of the most common causes of preventable intellectual disability. Most cases are due to thyroid dysgenesis, which can be agenesis, hypoplasia, or ectopy, and iodine deficiency is a common cause in areas endemic for iodine deficiency, such as Europe. Neonates initially have no significant symptoms due to the presence of maternal thyroxine, T4, from transplacental transfer. T4 is responsible for the stimulation of protein synthesis as well as carbohydrate and lipid catabolism in many cells. As maternal T4 wanes, metabolism is impaired and marked by a slowing of physical and mental activity such as lethargy, poor feeding, constipation, hypotonia. Accumulation of matrix substances cutaneous and internally results in non-pitting edema, as puffy face, umbilical hernia, protruding tongue, and a large anterior fontanelle. In addition, T4 is essential for normal brain development and myelination during early life, and infants are at risk of severe and irreversible intellectual disability. Treatment with levothyroxine by age 2 weeks can normalize cognitive and physical development. Therefore, universal newborn screening for congenital hypothyroidism is performed in the United States but not in all other countries. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. Choice A. Infants who are fed honey or exposed to spores from the soil are at risk for infantile botulism, which presents with constipation and flaccid paralysis. A large anterior fontanelle, umbilical hernia, and macroglossia are not seen. Choice B. Hypotonia and hypothyroidism are features of Down syndrome. However, the absence of other dysmorphic features, such as upslanting palpebral fissures, bilateral epicanthal folds, single palmar crease, makes Down syndrome unlikely in this patient. Choice C. Galactosemia is caused by galactose 1-phosphate uridyltransferase deficiency. Patients with this condition present with jaundice, vomiting, hepatomegaly, and lethargy after ingesting galactose in breast milk or formula in the first few days of life. This patient was previously breastfeeding well and has no hepatomegaly. Choice D. Hirschsprung disease is caused by abnormal migration of neural crest cells into the rectosigmoid colon. The lack of ganglion cells in this colon segment impedes gastrointestinal motility, resulting in failed meconium passage and bilious emesis in a newborn. Choice F. Phenylketonuria is most commonly caused by phenylalanine hydroxylase deficiency, resulting in hyperphenylalaninemia. It presents with developmental delay, light pigmentation, and a musty body odor. Your take-home message from this question is that congenital hypothyroidism is usually asymptomatic at birth. After maternal T4 wanes, infants develop constipation, lethargy, hypotonia, macroglossia, an umbilical hernia, and a large anterior fontanelle. Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.